Good morning, everyone. Today, we're going to talk about a critical medical emergency, stroke. Often called a brain attack, a stroke happens when blood flow to part of the brain is interrupted. This deprivation starves brain cells of oxygen and nutrients, causing them to die rapidly. The consequences can be severe, leading to lasting brain damage, disability, or even death. Understanding what a stroke is, recognizing its signs, and knowing why every second counts is crucial, especially for those at higher risk due to conditions like high blood pressure, heart disease, or diabetes. Let's start with the basics. A stroke is, at its core, a medical emergency. Imagine your brain as a highly active city that constantly needs a fresh supply of resources, oxygen and nutrients, delivered by its blood vessels. When that supply line is cut off, even for a few minutes, the cells in that part of the city, your brain cells, begin to die. This rapid cell death is what leads to the profound and often lasting effects we associate with stroke, from physical impairments to cognitive and emotional changes. The sooner blood flow is restored or bleeding is controlled, the more brain tissue can be saved. Strokes primarily fall into two categories. The vast majority, about 87%, are ischemic strokes. These occur when a blood clot blocks or significantly narrows an artery that supplies the brain, effectively cutting off the supply line. Think of it like a plumbing blockage. The second type is a hemorrhagic stroke, which is less common but often more severe. This happens when a blood vessel in or on the brain ruptures and bleeds into the surrounding brain tissue. Instead of a blockage, it's like a burst pipe, and the leaked blood puts pressure on and damages brain cells. We'll explore each of these in more detail. Before we dive into the stroke subtypes, it's crucial to understand transient ischemic attacks, or TIAs. Often called mini-strokes, TIAs are similar to ischemic strokes but involve a temporary blockage where blood flow is restored before permanent brain damage occurs. While the symptoms are temporary and may resolve quickly, a TIA is a flashing red light. It's a critical warning sign that you are at a significantly increased risk of having a full stroke in the near future. Therefore, anyone experiencing TIA symptoms needs immediate medical evaluation. Let's start with the most common type of hemorrhagic stroke, intracerebral hemorrhage, or ICH. This occurs when a blood vessel ruptures and bleeds directly into the brain tissue itself. The resulting blood clot displaces and damages surrounding brain cells. The primary culprit for ICH is uncontrolled high blood pressure, which, over time, weakens the walls of small, deep arteries in the brain. Other causes include conditions like cerebral amyloid angiopathy, arteriovenous malformations, and the use of blood-thinning medications, especially if blood pressure is not well controlled. Trauma and illicit drug use can also contribute. For an acute intracerebral hemorrhage, treatment focuses on limiting the damage. This means rapid and aggressive blood pressure control to prevent the bleed from expanding. If the patient is on blood thinners, immediate reversal is crucial. Surgical intervention may be considered for larger clots or if the bleed is causing significant brain swelling. Long-term prevention for ICH primarily revolves around lifelong, strict blood pressure control, which is the single most critical measure, along with managing any identified underlying causes. The second type of hemorrhagic stroke is subarachnoid hemorrhage, or SAH. Here, bleeding occurs into the subarachnoid space, which is the fluid-filled area that cushions the brain. The most common cause of SAH is a ruptured brain aneurysm, a weak, balloon-like bulge on an artery, often at the base of the brain. These can rupture under sudden increases in pressure. Other causes include AVMs and head trauma. There's also a specific, less severe type called perimesencephalic non-aneurysmal SAH where no aneurysm is found. When a subarachnoid hemorrhage occurs, the immediate and paramount priority is to secure the bleeding source to prevent rebleeding, which is highly lethal. This is typically achieved through either surgical clipping, where a metal clip is placed at the base of the aneurysm, or endovascular coiling, a minimally invasive procedure where platinum coils are deployed inside the aneurysm to seal it off. Managing serious complications like vasospasm, a dangerous narrowing of brain blood vessels, and hydrocephalus, fluid buildup in the brain, is also critical. Long-term prevention for SAH focuses on managing any unruptured aneurysms, strict blood pressure control, and lifestyle changes like quitting smoking. Moving on to ischemic strokes, the first subtype is thrombotic stroke. This occurs when a blood clot, or thrombus, forms directly at the site within an artery that supplies blood to the brain. This usually happens in arteries already damaged and narrowed by atherosclerosis, which is the buildup of fatty plaque within the vessel walls. The plaque makes the artery lining rough, promoting clot formation. The key risk factors are the classic cardiovascular ones: high blood pressure, high cholesterol, diabetes, and smoking. Long-term prevention focuses on antiplatelet medications and aggressively managing all these underlying atherosclerotic risk factors. Continuing with ischemic stroke subtypes, an embolic stroke occurs when a blood clot or other debris, called an embolus, forms elsewhere in the body, most commonly the heart, especially in conditions like atrial fibrillation, and then travels through the bloodstream to the brain, lodging in a smaller artery. These strokes tend to have a very sudden onset. Prevention primarily involves strong blood thinners, or anticoagulants, to prevent clot formation, and managing the underlying heart condition. Finally, a lacunar stroke is a small, deep ischemic stroke caused by the blockage of a very tiny artery supplying deep structures of the brain. These are strongly associated with long-standing, poorly controlled high blood pressure and diabetes. Aggressive blood pressure management is the most critical preventive measure for lacunar strokes. Recognizing a stroke is vital, and the FAST acronym is a widely recognized and incredibly effective tool. F is for face drooping, ask the person to smile. Does one side of their face droop? A is for arm weakness, ask them to raise both arms. Does one arm drift downward? S is for speech difficulty, ask them to repeat a simple phrase. Is their speech slurred or strange? T is for time to call 911, if you see any of these signs, even if they seem to pass, call for emergency medical help immediately. It's crucial to understand that FAST signs apply to all types of strokes. You can't tell which type it is without medical imaging. Some experts even suggest BFAST to include balance issues and eye, vision, changes, as these can also indicate a stroke. Remember, time is brain, so immediate action is paramount. The phrase, time is brain, is not an exaggeration when it comes to stroke. When a stroke hits, brain cells begin to die almost immediately. In an ischemic stroke, up to 1.9 million neurons can be lost every minute if blood flow isn't restored. For hemorrhagic strokes, uncontrolled bleeding rapidly destroys brain tissue. The most effective treatments are highly time-sensitive. For ischemic strokes, clot-busting medications like 4-TPA are most effective within a narrow window, typically 3 to 4.5 hours from symptom onset. For larger clots, mechanical thrombectomy, physically removing the clot, can be performed later, sometimes up to 24 hours in specific cases, but the earlier, the better. Getting care quickly dramatically improves the chances of a better outcome, reducing disability and saving brain function. If you suspect someone is having a stroke, your immediate actions are the most critical steps. First and foremost, call 911 or your local emergency number immediately. Do not try to drive the person to the hospital yourself. Paramedics can begin life-saving care en route and alert the hospital stroke team. Next, try to note the exact time when symptoms first appeared. This last known time is absolutely vital for guiding time-sensitive treatments. Stay with the person, keep them calm, and position them safely, on their side with their head slightly raised if conscious, or in the recovery position if unconscious and breathing. Most importantly, Do not give them anything to eat or drink, as swallowing may be impaired, and do not give them any medications, including aspirin. Aspirin is helpful for ischemic stroke but is extremely dangerous if the stroke is hemorrhagic, as it can worsen bleeding. Only medical professionals can determine the appropriate treatment after diagnosis. Once at the hospital, rapid imaging, usually a CT scan or MRI, is absolutely essential. This is because the immediate treatment differs significantly based on the type of stroke, and imaging is the only way to determine that. For ischemic strokes, the primary goal is to restore blood flow. This often involves thrombolytic therapy, like 4-TPA, which are clot-busting medications given within a narrow time window. For larger clots, a procedure called mechanical thrombectomy, which physically removes the clot, can be performed, sometimes even later than the TPA window in selected cases. Newer medications like tenecteplase are also improving treatment options. For hemorrhagic strokes, the focus shifts dramatically to controlling the bleeding and reducing pressure on the brain. This typically involves aggressive blood pressure management to prevent further bleeding, and often surgical interventions. These surgeries might involve clipping or coiling an aneurysm to seal it off, removing a large blood clot, hematoma, that's putting pressure on the brain, or repairing an arteriovenous malformation. If the patient was on blood thinners, immediate reversal agents are critical to stop the ongoing bleeding. The key takeaway is that the hospital's approach is entirely dependent on the stroke type, making rapid diagnosis paramount. The long-term effects of a stroke are highly variable, depending on where in the brain the stroke occurred, its severity, and the individual's overall health. Physically, survivors often experience paralysis or weakness on one side of the body, balance issues, and persistent fatigue. Swallowing difficulties, or dysphagia, are also common. Communication can be profoundly impacted, leading to conditions like aphasia, which is difficulty with language, affecting speaking, understanding, reading, and writing. Another common communication challenge is dysarthria, or slurred speech, caused by weakness in the muscles used for speaking. These challenges require dedicated rehabilitation. Beyond the physical and communication challenges, stroke often leads to significant cognitive and emotional changes. Cognitively, survivors may experience memory loss, especially short-term memory, as well as difficulties with attention, concentration, and executive functions like planning and problem-solving. Perceptual problems, such as difficulty recognizing objects or neglecting one side of the body, can also occur. Emotionally, depression and anxiety are very common after a stroke, often due to physical limitations, lifestyle changes, and chemical shifts in the brain. Survivors may also experience emotional lability, where they have difficulty controlling their emotions, leading to sudden mood swings, or even personality changes like apathy or impulsivity. Recognizing and addressing these aspects is crucial for holistic recovery. After the acute phase, treatment shifts significantly to preventing future strokes and maximizing recovery. This involves prescribed medications tailored to the stroke type and underlying risk factors. But equally, if not more, crucial is rehabilitation. This often begins within 24 to 48 hours post-stroke with a multidisciplinary team including physical, occupational, and speech therapists. Beyond the physical therapies, it's vital to incorporate psychological counseling and support groups, not just for the patients, but also for their families and caregivers, who often face significant strain. The ultimate goal of rehabilitation is to help patients regain lost functions, adapt to new challenges, and significantly improve their overall quality of life. The good news is that a significant number of strokes are preventable by managing controllable risk factors. The advice for stroke prevention heavily overlaps with general cardiovascular health. The single most important controllable risk factor is blood pressure control. Regular monitoring, a low-sodium diet, exercise, and prescribed medications are vital. Beyond blood pressure, adopting a heart-healthy diet rich in fruits, vegetables, and whole grains is essential. Maintaining a healthy weight and getting regular physical activity, aiming for at least 150 minutes of moderate-intensity aerobic activity per week, are also crucial. And, critically, if you smoke, quitting is one of the most impactful steps you can take, as smoking severely damages blood vessels and increases stroke risk. Limiting alcohol consumption also contributes to prevention. Continuing our prevention strategies, it's essential to diligently manage chronic conditions like diabetes and high cholesterol, keeping blood sugar and cholesterol levels within target ranges. Treating heart conditions, especially atrial fibrillation, is paramount, often requiring blood thinners to prevent clot formation. Increasingly, addressing undiagnosed sleep apnea is recognized as a significant stroke risk factor. Regular medical checkups are essential for screening and early detection. While strokes are more common in older adults, younger individuals also need to be aware of specific risks, such as blood clotting disorders, patent foramen ovale, PFO, or cervical artery dissection. It's also recognized that broader factors like social determinants of health and sex-specific screenings, particularly for women related to hormonal changes, significantly impact stroke risk. The field of stroke treatment and rehabilitation is rapidly evolving, bringing exciting advancements. We're seeing newer thrombolytic drugs that offer faster administration and research into extending the treatment windows for existing therapies, guided by advanced imaging. Scientists are also exploring neuroprotective agents designed to shield brain cells from damage during a stroke. Technological innovations are transforming rehabilitation with device-based therapies like neurostimulation and robotics, and the power of artificial intelligence and machine learning is being harnessed to improve everything from early diagnosis to personalized rehabilitation strategies. Telerehabilitation is breaking down geographical barriers, making specialized care more accessible. And in regenerative medicine, stem cell therapy is being explored for its potential to repair damaged neural tissue and promote recovery. These advancements offer tremendous hope for the future of stroke care. Before we conclude, let's address a nuance that sometimes causes concern: a visibly throbbing carotid artery in the neck. Seeing a prominent pulse here isn't typically a direct sign of an acute stroke, nor does it immediately mean you have carotid artery narrowing. More often, it indicates a wider pulse pressure, the difference between your systolic and diastolic blood pressure, or generally higher blood pressure or heart rate. However, asymmetry is key here. If you notice a significant difference, one side is visibly throbbing much less than the other, or is almost invisible, that is a more concerning finding. This asymmetry could indicate narrowing, or stenosis, or another issue affecting blood flow in that less visible artery. If such an asymmetry is observed, it absolutely warrants a prompt medical evaluation by a doctor. While not an immediate emergency like a FAST sign, ignoring a diminished pulse on one side could mean significant underlying carotid artery disease, which, if left unaddressed, greatly increases your risk of a future ischemic stroke. Your doctor can perform a simple ultrasound to check the blood flow. In conclusion, understanding stroke, its diverse forms, and its profound impact is the first step toward prevention and effective response. Recognizing the immediate signs using the FAST acronym is critical for initiating life-saving emergency care. But our most powerful tool against this devastating condition is proactive, long-term health management. By diligently controlling blood pressure, embracing a heart-healthy lifestyle, managing chronic conditions, and avoiding smoking, we can significantly reduce our risk. Furthermore, being attentive to subtle physical signs, like a noticeable difference in the visual throbbing of the carotid arteries, and discussing these observations with a healthcare provider can lead to early detection of underlying issues. This proactive approach can potentially prevent a stroke before it ever occurs. The continuous advancements in treatment and rehabilitation offer renewed hope for survivors. In the fight against stroke, knowledge empowers us, prevention saves lives, and swift action makes all the difference. Here are the references used in preparing this presentation. which you can consult for more detailed information and further reading on the topics discussed today. These are all reputable sources from leading health organizations and institutions.